And we are broadcasting. So, Dr. Andrew Miners, we are live today. Welcome everyone to Medcan Presents Sports Therapy and Rehab. This is a Q&A with Dr. Andrew Miners. How are you, Dr. Andrew Miners?
I'm good, thanks, Chris. How are you doing?
Yeah, I'm
happy
good.
to be here.
Great. I am going to stop sharing, and so we get the full screen. And you're there in your office with your various tool sets. I love the skeleton in the background there.
Yeah, this has become my home office in my basement, and it works quite well. Actually, this looks like a desk that I'm at, but it's actually my ping pong table. So I needed extra space to have multiple monitors and cameras, so my ping pong table fit the bill. And I wanted to have extra space for doing the virtual appointments. Yeah, it works quite well.
Andy, so I'm going to go through your bio, and then we'll just start with your presentation. So Dr. Andrew Miners has been in clinical practice for 16 years, and at Medcan for the last 10 years. He is the clinical director of the Sports Medicine, Therapy, and Rehabilitation Department, and is a certified specialist in sports injury and occupational and physical rehabilitation. Andy, I think, as I was telling people about this webinar, I think one reaction I had was that people were surprised that virtual rehab could happen, but actually you can do quite a lot with it. Can you talk about that a little bit?
Totally. It's a relatively new thing. In healthcare in general, there has been this transition to virtual care, but when it comes to rehabilitation, so people would think of physiotherapists, chiropractors, chiropodists. People don't think of virtual care because they think of hands-on. So it's a very new concept. And so I think that new concept sometimes presents a barrier to people. They're like, well, how are you going to help me with my knee over the internet? Or, my shoulder hurts. What are you going to do for me over the internet? You need to, hands-on manual therapy or modalities. And sometimes so people think about having things done to them when they go to a therapist. And yeah, that does happen. But a large part of what a therapist does in any clinical interaction is educate. So give education on the injury, the prognosis, meaning what to expect and what the course of recovery is going to look like, what to do, what not to do, things to do, things to avoid, self-care strategies, how they can start treatment on their own. And obviously progressing into rehabilitation, whether it's early stage rehabilitative exercise or self-care strategies going to late stage. And a lot of that is all education-based, and more importantly, things that you as a patient do to yourself as opposed to things that a therapist does to you. And so those are the major components of recovery, and that can all be done very effectively in a virtual setting.
So you're providing the client with tools to help themselves, essentially.
Exactly. So, a patient might present with shoulder pain, and they're at home, like in this situation, they're home, they're isolated. They're dealing with pain, they're not sure what to do. Should I exercise? Should I not exercise? It hurts when I do this. Should I do that or should I avoid that? These are all these questions that patients have with injuries. And in this situation, unless they have access to a virtual clinician, whether it's a medical doctor or a therapist, they don't get the answers they need. And so they think there's a barrier, meaning, I can't go to my local physio or chiro to get those answers because they're closed down right now. But there is an option, and they can do this, and I can answer those questions and get them going on the early stage self-care strategies that they need to, one, reduce pain and also accelerate recovery. And that can all be done in a situation like this, where I can, just as you and I are right here, we're interacting, we're communicating, I can take a full history, then I can guide you through a physical exam. For example, if it's a shoulder, I can have you raise your arm up and see how far you can go. I can ask you if it hurts. I can ask you to point to where it hurts. I can ask you to describe the pain. Is it just in one spot or does it travel? And I can even do certain things like orthopedic testing that is very common in a medical interaction, orthopedic interaction, where you might be doing certain movements that are actually tests. You can even do self-muscle testing, resisted testing to find out, does that hurt? Does it not hurt? Where does it hurt? And how does it hurt? All of that gives me information on what's going on with you, even though I haven't put my hands on you yet. And I can then, from that information, prescribe early stage self-care exercises, whether it's something as simple as ice or heat or movement or what to do and what not to do. Topical care such as over-the-counter medications might be necessary, or even in a more extreme situation, if you've got a more significant injury, what we can also do virtually is say, hey, this is more serious than I think you might be aware of. And so therefore, we're going to recommend that you do seek urgent care. or virtual care with a physician, which we can all do at Medcan. So you can do urgent care in person if it's really serious, or collaborate with a physician, whether it might be for imaging or medication or advanced referral. We can collaborate that way and really provide excellent care over the internet.
Oh, that's fantastic. I think we're probably 8 weeks into this social distancing and physical distancing, and I think about a lot of things changed once we started physical distancing, and for a lot of people, they started exercising differently, which can speak to injuries. Another difference that could speak to injuries was that people started working from home and perhaps didn't have the best environment to work from home, to spend 8 hours at a laptop or at a computer. So what are you hearing? What are some of the injuries or what are some of the issues that you are hearing from your clients?
Sure. We do hear of, injuries like acute injuries, but more commonly what we're actually hearing is, progressive onset or relatively sudden onset, but not traumatic type injuries. For example, we've become isolated and, you've got this extra time in your home and you want to give yourself a mental break. So you might have taken up running, or you started doing exercises and maybe you aren't used to exercising or you aren't used to running. And so you're starting to feel aches and pains and sorenesses in your body. And you're like, what is that? Did I injure myself, or should I ignore it? Or should I continue to run, or should I continue to exercise or not? So we see those types of injuries, which might be more of a strain, sprain type of thing, muscle or joint type aches and pains. But also what we're seeing is posture related pain that, is nothing new. It's nothing new in the workplace, but you may have an ideal setup in your office, where you've got a proper chair and a proper workspace, and you're getting up and you're interacting with your colleagues in your workstation. Whereas now, let's say at home and you don't have a proper workstation, you're transitioned to sitting on the couch for 6 or 8 hours a day, and you're not getting up as much because now everything is virtual. So everything's coming to you as opposed to you going to them. And so you found yourself now in a less than ideal workstation, that because of the amount of time that you're in that position, whether, slumped and sitting on a couch, for example, you're starting to feel aches and pains in areas that you didn't otherwise feel aches and pains in. And so that's the other thing that we're seeing is sort of these postural or sustained posture related pain injuries, as well as the activity related injuries. And so we're seeing those are sort of the two ends of spectrum that we're seeing from our team of online physiotherapists, chiropodists, which deal with foot pain, and chiropractors. So that's what we're seeing.
I also think about the person who is seeing, a professional, either somebody from the rehab sphere or a chiropractor, who was moving through a program of therapy and then it was interrupted. And what happens then? I mean, that strikes me as that's a tough situation as well.
It is, people get lost. They're like, well, I was doing this. Should I continue to do that? Or I've been doing that for a few weeks and, do I need something new? And we can all try that. You'll see, Chris, you can see behind me, and this is a great example of how a therapist can interact with you virtually. I've got earbuds in and I've got this full space. I've got various things. I've got a mat, I've got a Bosu ball. So I can take people through exercises and prescribe and progress rehabilitation. So if you've sort of plateaued with your rehabilitation because you've been doing the same level of engagement of exercise for a while, we can progress those quite easily. And I can have them demonstrate. I do exercises with patients. We do them simultaneously, just like a virtual workout. Instead, we're doing virtual rehabilitation where I can take them through shoulder exercises or stretches or whatever the case might be, low back rehabilitation, lower body rehabilitation. So quite easily with the camera, I can zoom in and out and we can interact quite effectively to prescribe exercise or do an examination, or, if it hurts in your back, I can have you do ranges of motion. So we can have a really engaging, interactive experience virtually. So we can totally help in those situations, whether it's a new injury and you're not sure what to do, whether it's an ongoing injury that's been interrupted in care, or whether it's a chronic issue and now you've got time and you want to address it. We can help in all of those instances. That's
fantastic. Well, can we walk through some of the more common issues specifically that you're dealing with? One, for example, we were talking about the woman who was on her couch for a long time, and that strikes me as a common. You're in a new environment, you're sitting in somewhere where perhaps actually it's not made to be. Well, I guess a couch. Well, speak to the couch example, perhaps.
Yeah. So You know, even when I'm not doing virtual care, I get a lot of questions around sitting, right? Sitting related and posture, what's the best posture? How should I sit? And it's an interesting concept because I would argue there really is no perfect sitting posture. The problems arise with sustained postures, meaning being in one position too long, regardless of what that position is. Now, there are positions that could arguably be better or worse. And so we want to avoid prolonged periods of sitting. So in this case, I did have a patient that had noticed, we were communicating about a different complaint. And she started saying, but while I've got you here, can I ask you about my back's been bothering me lately? And so she goes, I've been finding myself, she was sitting on a couch for a long period of time, and, she was slumped down and low, and she had her laptop on her lap, and beside her, and she was doing this, and she was in this position, sometimes for an hour at a time, or 2 hours at a time, or 3 hours at a time. And she was noticing that she was getting stiff and sore, and she'd stand up and she'd be like, oh, these types of responses, which we can probably all relate to. And she said, I didn't get this when I was at work. And I said, well, describe to me the differences between now and then. She says, well, I'm in one position longer. I'm sitting on this couch. I don't have a proper workstation in my condo, and she goes, and I just felt comfortable here. So I started working here. She goes, but the difference was when I used to do it in the past, it would only be for a short term. Now I'm doing it all day. And that's the thing. When we talk about posture-related stress, it's less of, we talk about perfect posture and how we should do that, but even then people get tired and fatigued. There's three types of things, about that leads to posture-related pain. One is sustained passive tissue stress. So an example of passive tissue stress that might be helpful, if I look at my hand here, and I just use my other hand to bend my finger back. Right now, I'm doing this to my finger. So I'm putting a passive stress on my finger. I'm putting compression on this side and tension on this side. And it doesn't bother me right now, but if I put this stress on my finger for an hour or 2 hours, my finger's gonna get sore and I'm gonna wanna, it's gonna get stiff. So that's passive tissue stress. That's like sitting in a slumped position on your couch. It's fine at the beginning, but as that tissue is stressed longer, even though it's a very low load, a very small amount of force, it's creating tissue stress over time that leads to fatigue to tightness and soreness eventually to pain. That's one thing that happens. The same thing can happen though with perfect posture. Everybody says that they should sit up tall and sit like this. Am I cutting myself off there? There we go, sorry. And right now I'm using muscular energy to fight gravity. So I'm still using tissues to fight a force. It's the same idea of me holding out my remote here. It's really light, I can do it no problem, but my muscle's on. Now, it's easy to do for a minute or 2 minutes or even 10 minutes, but when I do it for an hour, I get fatigue. Fatigue leads to soreness and pain. So both passive tissue stress as well as active tissue engagement are occurring when you're in a static sitting posture. And eventually that leads to tissue soreness and tightness or fatigue, and that can lead to pain, especially when done hour after hour, day after day, in and out. And so, in her case, I said, we need to stop sitting on the couch so much. It's not that sitting on the couch is inherently bad. It's just that any posture, when it's sustained, has the risk of causing tissue soreness, be it fatigue and sustained or repetitive tissue stress. And so I would argue that a lot of the time, I didn't coin this phrase, I wish I did. I can't remember where I heard it, but the best posture is actually the next posture, as a good key phrase. So it's better than sitting in even perfect posture for a prolonged period is to change posture often. So in her case, I had her move from her couch to her kitchen table, right? To change it up. It's not, don't sit in the couch too long, don't sit at the table too long. Variety is better. So changing posture often, and even changing workstation positioning so you're not putting the same stress on the same tissues repetitively is better than even sitting in perfect posture for a prolonged period. As well as, just get up and do some opposite stuff. I talked about this in an Instagram video, but just moving around and doing the opposite of sitting so that you're breaking the monotony of repetitive tissue stress that leads to pain over time. So you're just breaking it up and changing posture often.
So it's actually almost this prescription to fidget. It's
absolutely
therapeutic fidgeting.
That's a great therapeutic fidgeting. I like that term. As long as it doesn't become distractive.
Yeah.
But yeah, it is. So, you could argue there is no perfect posture. There's just prolonged postures and the need to avoid those prolonged tissue stress. And, if anybody, and you can all relate to this, you're sitting wherever or doing whatever. And after a certain amount of time, it gets stiff and tight and sore and you automatically move. Sometimes what I recommend for people that are experiencing back pain, meaning they're recovering from or experiencing, is a lot of time people twitch and fidget when the soreness comes on, but doing it before it comes on is better. So, every 30 minutes or so, you stand up and you do a standing extension relief and you move, or you change posture and you shift your position, or you change to a different chair or a different workstation. So you're not, transitioning from sit to stand, as an example. There was a trend in the workstation to go to standing desks, but sure enough, people were standing too long too, right? If you stand for too long, it has an increased risk of back pain, lower extremity vascular return issues, calf soreness, foot soreness, etc., that have been reported in people that stand too long. And so a standing desk wasn't a solution, just like prolonged sitting wasn't a solution, but having a modifiable workstation that allows you to change posture and go from sit to stand, combined with getting up often and going for moving around your office so that you're avoiding prolonged static posture in general, was shown to be better and help to improve people. Doesn't mean you can be pain-free all the time, but it's about minimization.
Oh, that's so interesting. That a standing desk isn't necessarily better than a sitting desk. What's better is the transition between the two.
Yeah, variety. Life is a normal curve, right? Too little and too much of anything is usually bad, right? We want to be in the middle. And that goes with muscle and joint injury in a lot of cases, as well as rehabilitation, as well as posture.
Oh, that's fascinating. So if you don't, well, let me throw it over to you. We do have some questions. Do you have more to say that you want to go through or do you mind if we move into the questions?
Yeah, let's be organic about this. Let's answer some questions and away we go. Yeah.
Okay, I'm actually, so the first one, I'm actually not sure whether you can answer specifically, but let's give it a shot. I was doing seated rows and pulled something in my back. What should I do?
I can comment on that.
Question.
It is.
Okay.
I can. So, without examining a person and without doing a proper history and proper physical exam, I'm not going to come up with a diagnosis, and I can't prescribe specific treatment for a specific injury without having a proper virtual interaction with someone. But in general terms, if you've created a muscle strain, which means you've overloaded that tissue, either from a repetitive perspective, creating fatigue and soreness, or peak loading, which means you just put too much force through something and you created an injury response. You just did what I call breaking the rule of twos often, which is doing too much, too soon, too hard, too long, or giving yourself too little rest and recovery in between bouts of exercise. But in this case, if you've overdone it a bit or you've strained a muscle, there's two ways that people often think about recovering from this. One is, stop. If it hurts, stop. We call it avoidance behavior. That's been known to be not that helpful for recovering from exercise too, or from injuries. And the other adage that a lot of people come in with is no pain, no gain, meaning, I hurt my back, but I'm going to keep working out. I'm going to push through the pain. And that also is not helpful. So in this situation, what I would recommend you do is movement to pain, but not through pain. So meaning that if you're able to do your regular activities of daily living and move around, you're like, oh, I feel it, but it's not that bad, then continue. But if you start to feel, I usually give a pain scale on this concept of going to pain, but not through pain. So if 0 is no pain, no tightness, no stiffness, no whatever the symptom might be, and 10 is excruciating, 10 out of 10, take me to the hospital, call 911, that's a 10. So on this scale, I usually recommend probably going up to and including a 4 out of 10 on that scale is probably okay. So when people are engaging with an injury and they're like, should I or shouldn't I? What should I do? I always say move. So for example, in a sprained back, you could do something as simple as a cat-camel type exercise, for mobility, some gentle stretching where you're doing some spinal mobility through those muscles and just moving the spine and muscles. You could link that with some yoga type movements like a modified rollback or modified child's pose to just get some stretching and movement through that tissue. But when you're doing it, if you're feeling the soreness or the quote injury, and you're like, okay, I feel it, but is it a good pain versus a bad pain? Meaning that, is it up to and including a 4, or is it greater than that? If you're moving past a 4, it's more likely that you're over pushing, that you're doing too much, and so you need to gear back. Okay. If you don't feel anything, that's fine. But feeling soreness isn't a bad thing. And I call this the difference between hurting and harming. So in that case, the recommendation would be move. Don't be afraid of exercising, but don't overdo it. Start small, build gradually, and as you feel you're getting better, you can challenge a little bit more. Hopefully that was helpful to whoever asked that question.
So in the, just to go back, in the moment, so the injury happens, and should the person, okay, so and let's say it goes past, in the moment, it goes past that 4 benchmark, that 4 threshold. Let's say it's a 6 or a 7. So probably, presumably, you stop doing the rows or whatever the exercise it is. And what do you do next? Do you go to the freezer to get some ice, or do you move straight into the stretching, or what?
So gentle movement, if you're able to move just gently in that area, keeping it limber and loose to pain, but not through pain. So feeling mild discomfort is okay. But yeah, you could use ice or heat. When it comes to best evidence, it's actually not that well researched on ice and heat. But the general rule of thumb that I like to give for people that is if it's a brand new injury, and especially if it's more significant, like if there's swelling or pain, then using a little bit of ice probably helps to just give a little bit of a topical analgesic, meaning just reduce the symptoms a bit. And it might feel good to put some ice on it. If it's more of a chronic intermittent issue, then usually it feels better when it's warmed up. So using heat in that case is usually better. But ultimately, my recommendation is whatever feels good, go for it. So meaning that if you've got this injury and you start with ice and you're like, oh, that feels great, then go with ice. If it helps, go for it. So yeah, using ice and some gentle movement. If you're like, well, the ice isn't helping, but if I put some mild moist heat on, for example, a mild heat pack, and like, oh, that feels better, then yeah, use heat. So whichever feels better, go for it.
Okay,
but if you think about, go ahead. But if you think about it like a sprained ankle, typically you go for ice. If it's more of a chronic injury, you'd go for heat. But ultimately, whatever feels better, go for it.
Okay. With respect to, so I'm going to move into another question, which is another general one, but it relates to, well, I'll just read it out. So, Dr. Miners, I've heard varying things about what to do before sports and running, specifically. Should I stretch? Should I not stretch? Do I stretch after? Do I stretch before? What's the prescription on stretching?
That's actually a really big question, believe it or not. So, and there's actually a lot researched and written on stretching, and there's different ways to stretch for different reasons. So, a high level, I'd say you'd have to ask, why am I stretching? And that would determine what type of stretching you do. But to answer this specific question, for a warm up or before sport, what you should do is the general trend is suggesting that you do what's called a dynamic warm-up, meaning that you do activities or movements that mimic the action or the activity that you're going to be doing. So if you're a runner, for example, then just going out and going to run, 9 times out of 10, you won't have a problem with that, meaning you won't get injured. But the recommendation is to warm your tissues up, get them used to the activity that you're going to do in a slow and gradual progression is better. For example, we call this, doing a dynamic warm-up. And with running, it's about, you might get out, just do a brisk walk first to get started with a brisk walk, get your heart rate up, get your tissues warmed up. And then you might do some running related drills, which walking A's, or doing an A skip where you're doing a B skip where you're working up your hamstrings and loosening your hips with doing some hip openers and closers, doing some movements, some pony exercises, which get yourself warmed up to do the activity, and then you start to engage. Same thing for soccer and things, doing things that mimic the movement, starting small, doing some light ball drills, doing some kicking drills, doing some cutting drills, starting to start small and build gradually. So doing this concept of a dynamic warm-up prior to sport has been shown to be more beneficial, and it's hard to prevent injury entirely, but more beneficial for engaging your tissues to be ready for the sport, and therefore hopefully being more ready to tolerate that sport and therefore preventing injury, as opposed to static stretching and going out and just doing there's a lot of research around static stretching reduces power output from the muscle. So doing a static stretch before running the 100-meter Olympic Games when a 1/10 of a second matters doesn't make sense. But that also got taken too far to say you shouldn't stretch. And that's ridiculous also. So if someone wants to do a combination of my hamstring feels tight, so I'm going to do a nice stretch and it feels good, there's nothing wrong with that. And if you combine that with some dynamic warm-up, loosening your tissues before you go and run, that's probably your best bet for practically preventing injury. Does that make sense?
Okay. Yeah. No.
So
that's
dynamic
fantastic.
warm up
Okay.
as opposed to static stretching. And then, you know, at the end of, when it comes to actual static stretching, the idea would be to do it after you're warmed up. So it's probably better to do your static stretching if you're looking at increasing range of motion, if you need to increase range of motion when your tissues are warm. So more at the end of a workout, or perhaps during a workout mixed in with your other exercises. That's nothing wrong. But for the average Joe, it's really do whatever feels good.
Okay. Do whatever feels good. That sounds, I mean, it sounds like a good broad general prescription. We have another question about plantar fasciitis, which
Okay.
how the comment comes from a woman who started running and is worried that her foot pain, heel pain actually, is coming from plantar fasciitis as opposed to just repetitive trauma. I don't know enough about plantar fasciitis to, I mean, maybe those two things are the same thing, but basically the question is, how do you know if you have plantar fasciitis and need to stop running versus, you know, it's just an injury that you can run through?
Sure. This would be like this, the person who asked this question, he or she would be a great candidate to do a virtual chiropody appointment. So speaking with one of our foot specialists in a virtual situation to get a full history and physical examination. But foot pain is pretty common. And if you aren't used to running, whether you are or not used to running, plantar fasciitis, which it was more historically called, is pretty common. And in the bottom of the foot, there's the dense ligamentous connective tissue that comes down, as well as the muscle tissue that's there. And that's called the plantar fascia, and it attaches into the base of the heel. So classically with plantar fasciitis, which is probably more accurately termed plantar fasciosis because it is a repetitive strain injury. It is a repetitive intolerance to loading or use or function that leads to pain and stiffness. And it's usually not entirely inflammatory, which is why the itis suffix doesn't usually work. But it's classically pain at the inside bottom of the heel that then can spread down to the foot. Classic symptoms of plantar fasciitis is pain first step in the morning. So getting out of bed and walking to the bathroom, feeling pain and soreness that then gets a little bit better as it warms up, but also gets sore if you're on your feet too long, walking on hard surfaces, or if you've been overloading it with prolonged running. And so if any of those symptoms sound familiar to this patient, and it's probable that they do have plantar fasciosis, which is a very common form of plantar-based foot pain, and I would highly recommend that they engage in a virtual consultation with one of our chiropodists at Medcan, which we can easily set up.
That's a good, I think that's a good segue because we're going to move to, move to Medcan. We're going to start all from the very beginning on Medcan here. So I want to show people how to get to your services, Andy. So what we're going to do, so here's the Medcan, the general page. We're going to go down to the Learn More button for the Keeping Communities Healthy. And if you just click on virtual appointments right here, you can, you go to the Move page and you scroll down and here we are with virtual sports therapy and rehabilitation, and you can book now. You click book now there. And Andy, can you talk about the breadth of services that you provide? Because it's not just sports therapy and rehab. It's also, you mentioned chiropractic. Can you walk through the full?
So we have virtual appointments that can help and engage, just as I've talked during this webinar. Chiropractors that are online can help, a team of physiotherapists that are online to help, and chiropodists or foot specialists that are online and ready to help. We also have registered kinesiologists that if we have specific or advanced rehabilitation protocols that we need to implement or supervise with, we can link our therapy team with our rehabilitation team through registered kinesiologists and do virtual rehab sessions, guided and supervised virtual rehab sessions. So those are our four main offerings in our Department of Sports Therapy and Rehabilitation. So we have all of those, and we can link that together with medicine as necessary. So linking virtual appointments with our medical doctors if we need additional care, help, such as medications or imaging or additional referrals. So we've got the full suite available of virtual services through Medcan. And like I say, you'd be surprised at the benefit and the amount that we can do online virtually in this setting. It's quite amazing, actually.
That's fantastic. So, okay, one last question, actually. Who is supposed to figure out how do you know whether you need a kinesiologist or a chiropractor, or do you just call the number and then, or are you supposed to decide and you call and you say, I need to speak to a chiropractor?
So, great question. So, we don't have direct linking contact to our registered kinesiologists. Those are delegated care through our therapists. But you could call, if you've got a foot problem, you want to see a foot specialist, so you see a chiropodist. If you've got a general ache and pain, regardless of where in your body, then you're more than able to be managed by our physiotherapists or our chiropractor. So either or really can manage you from a musculoskeletal pain complaint. Our team at Medcan is expert professional care that provide guidance along any kind of muscle and joint therapy through a number of different modalities. And we all practice and follow best evidence strategies on how to do that. So our team of physiotherapists and chiropractors always work collaboratively and can easily manage all of your conditions. So if you have a preference, you can choose. If you're not sure, we can help you either way.
Well, that's fantastic. Well, thank you so much. We're out of time. Thank you so much for this. I've found this personally interesting, and I hope our viewers have as well. Thank you, Dr. Miners. Is there anything final that you want to say? That's great.
No, I don't think so. I hope everybody is staying well and being safe, and don't be afraid of virtual care. It's quite effective.
Absolutely. Okay. Thanks very much. This was Medcan Presents, and it's every Tuesday and Thursday at 12:30 p.m. We will see you next week on Tuesday for an update on COVID-19 with Dr. Peter Nord, as well as an overview of the Medcan Safe at Work system. Okay. Thanks a lot.